as physicians, are you comfortable taking your masks off in public?
I am. I was on vacation up north. I did not wear a mask at all. The people I was staying with, all of us were vaccinated, so I feel very comfortable. Vaccines are pretty good, and I take a lot of comfort knowing that my kids and my wife are also vaccinated.
Great. How about you, Dr. Nabha?
I think it depends for me. I have two young children. And so when I take them to the grocery store, they're wearing masks, and I'm in solidarity with them. I'm wearing my mask also. I think it really depends on where you are. If you're in a place where you're outside and the vaccination rates are high, I feel pretty comfortable taking off my mask. But in certain areas where I just don't know, I keep my mask on. I have immunocompromised family members, and my children haven't been vaccinated. So I still have that mask on it sometimes.
Yeah, I appreciate both of your candor in that question. And I think that's I think something all of us can relate to, is that it depends, right? Depending on our family situation and where we are. As the mom of an 8-month-old who also is somewhat immunocompromised, I'm in the same boat as you, Dr. Nava. But if she weren't where she is, then I might be more in Dr. Cunningham's boat. It's not that I don't have faith in the vaccines. It's again just that risk analysis based on each of our own situations. So thank you for being so open and honest about that. Question for you, Dr. Nabha. When we talk about infectious disease and COVID specifically, how long does natural immunity last? So in other words, we heard from Brian Love, who talked about having COVID and still getting the vaccine. So the question I would have is, how long does that natural immunity last? And why is it important for people who had COVID to get the vaccine, or is it?
Yeah, so number one, if you've had COVID, the recommendation is still to get the vaccine. Now, the CDC has changed the recommendations. They used to say wait 90 days after you've had COVID to get the vaccine. Now, the recommendations are get it when you feel better, essentially, at least 10 days after your symptoms have resolved. The reason for that is that we still are trying to understand what that natural immunity means. What does it mean to have COVID and to recover? How long does that protection last for? We suspect it probably lasts for at least 3 months, but there's lots of little places where there's data out there that tells us it's 3 months, it's 6 months. Really, we just don't know, and the safest thing is to vaccinate, even if you've had COVID.
Okay, great. That's really helpful. Dr. Cunningham, anything to add to that?
No, I agree completely. I think the vaccine gives probably better protection and longer protection. At least the preliminary data is very favorable for that.
Okay, great. And so Dr. Cunningham, can you talk a little bit about how this Delta variant is impacting communities with low vaccination rates, like Detroit, as we just heard?
Sure. So the Delta variant, what's unique about it, it's the first time two separate mutations that are already out there have combined into one virus. So this may be another strain that's very easily transmitted. There's not a lot of data on it yet, but it certainly looks like it's very easy to spread. Right now, about 20% of all the infection in the United States right now are this Delta variant. The good news is the vaccines do look very effective. Pfizer's about 95% effective. It's 88% for the Delta variant. So the vaccines are really making me feel good, but it's very possible we're going to see more surges. Hopefully they won't be quite as bad, but if we have pockets of unvaccinated people, I would not be surprised to see increasing number of COVID cases.
So to that end, this morning I had a conversation with a number of school leaders, and we were talking about the differences between the vaccination rates and what's happening in Detroit versus what's happening outside in other parts of the city, as health department just talked about. And so question came up is, do we need to behave differently in areas with low vaccination rates versus high? And what happens as we have sort of our borders are open, right? They're porous borders. So you've got kids that live in Detroit, for example, going to school or people going to work in other areas and vice versa. So, for either of you, is there anything we need to do differently as we cross into areas that may have lower or higher vaccination rates?
I think if you're fully vaccinated, I think you're fully vaccinated, we're talking about the Delta variant, you can feel safe that you're likely very much protected. But at the end of the day, it's all about mitigating your risk, right? So if you are someone who has family members who are immunocompromised, or you yourself have been vaccinated and you're immunocompromised, or your children, young children, it's all about reducing your risk. So if you're in an area of the state where the vaccination rates are higher, you can feel a little bit more safe about that. But I think at the end of the day, I mean, we're playing with some numbers of 10 to 15%. I think it's all about risk at the end of the day. How much risk are you going to take in terms of exposure? But if you've been fully vaccinated, you have a normal immune system, quote unquote, I think it's safe to be able to not worry about the different numbers in the different counties in Michigan.
Looks like Dr. Cunningham is agreeing. So Dr. Cunningham, as we talked about, I was talking to some school leaders today, so our conversation was focused on the students and the kids. And is there any reason for us to be concerned in the fall, for example? And I'm talking about unvaccinated kids, so at this point, younger children. Is there anything that we need to be concerned about as we get them back together in the fall? And some of them would be coming from, homes or areas that are unvaccinated versus vaccinated. Is there anything what's your prediction of what we can expect?
Well, we know schools are a good place for different infections to be shared quite easily. And even if not all kids are going to get very sick from COVID, a small number will. But I worry more about them bringing it home to mom or dad or grandma or grandpa or other family members who might not be vaccinated, who might not have a good immune system for various reasons. So I think we have to keep close attention to what the numbers are in the fall to see, do we still need to have masks worn in school? Mm-hmm. And, there are areas of the states with higher vaccination percentages, but the magic number really, if you want to get these viruses under control, seems to be 70% fully vaccinated, at least based on the Israel studies. And there's very few counties in Michigan that are that high, and most of them, I know Leelanau County is very highly vaccinated, but they have a whole surge of visitors this time of year. So I really don't think any place is quite ready to yet say we're not going to worry about it based on our rates.
Yeah. Well, would you recommend that schools sort of plan for masks and it's a happy surprise if we're not able to do it? Or, are we at that point?
If we're not going to have a whole lot more vaccination by people in the state, I think masks might be a very reasonable situation, especially the older kids. I get it, for younger kids, it's very difficult, but there's also some advantages to wearing the mask so much. I don't know when the last time I had a cold was. I haven't had the flu in many years because of the vaccine. So I've actually enjoyed not having any colds or anything. So when respiratory season comes up, even though I'm vaccinated, I might still choose to wear a mask in the grocery store or on large gatherings.
Mm-hmm.
To add on to what Dr. Cunningham is saying, our flu rates this year in this country have been historically quite low. We've seen a reduction in respiratory viruses in general, just simply by wearing a mask.
Okay, so masks have their advantages, right?
I think this past year, there were only 3 laboratory confirmed flu cases in the entire state. And it's not because people are testing less. I can tell you at Henry Ford, when we test for COVID, the test also includes influenza. So we're just not seeing it.
So if you are vaccinated and you get COVID, how does that impact you differently? And can you still get and spread it asymptomatically if you're vaccinated? Dr. Napa, I don't know if you can offer some insights on that.
Sure, absolutely. So right now, the CDC recommends that if you've been exposed and you've been fully vaccinated, and that was outlined earlier, right? So you're at least 2 weeks post your second mRNA vaccine, if it's Moderna or Pfizer, or 2 weeks after your J&J vaccine, you are fully immunized, you're fully protected. So therefore, the recommendation is you don't have to quarantine. Now, could you asymptomatically spread that virus to someone else? It's highly unlikely. Is it possible? The answer is always going to be, we can't say this is ever going to be 100%, but we can say that we know that even individuals who were exposed, that they are highly unlikely to spread it over, who've been fully immunized, highly unlikely to spread it to other people.
Okay. Okay, so that's good to know. That gives a little comfort as those of us here there. Dr. Cunningham, earlier you talked about 70% in the Israel study. Can you talk a little bit about how we came up with that 70% number, and what happens when that number is reached, and what happens when it's not reached?
Sure. So Israel was very aggressive getting their COVID vaccines out. They would vaccinate anybody. You show up, they didn't care what your race, religion, age, they just vaccinated people. And it turns out when they got to about 55 to 60% of the population fully vaccinated, they had a massive reduction in the number of new cases. When they got to 70%, it went even lower. So it may be that the herd immunity is 70% for COVID in populations. Now, herd immunity means there's enough people who are vaccinated that if a virus or infection comes into that community, transmission will not keep going on because there's so many people who are vaccinated. That number varies from virus to virus, bacteria to bacteria. But if we could get to 70% of the state fully vaccinated, I think we make the chance of future surges super, super low, and any surges are likely to be much less severe in comparison to the hell we've been through with these 3 major surges we've had in the past 18 months.
To add on to that, I mean, comparatively, it really depends on how contagious that illness is, as Dr. Cunningham said. For example, when you think of other really infectious contagious illnesses like measles, that number is very different. It's not 70%, it's in the 90s. So you really need to get into the 90% to get that herd immunity. So it depends on what that infection is.
Okay, but for COVID, it looks like 70% seems to be our magic number, which our transmission starts to die down. And then would it also be safe to say that we would see fewer variants at that point because there's just fewer places for the virus to be?
The more you have replication, the more spike in the number of cases, the more mutations you're going to find. So it's really kind of a race, so to speak, to be able to get to that number or in or around that number before the virus mutates into something that won't be it mutates to so a vaccine won't be as effective.
Great. And Dr. Nava, one of the things you and I talked about early on, and I just wanted to share it with the audience and ask you to talk a little bit about your work with telemedicine and just kind of how you are bringing infectious disease care to populations that are unable to where they're underserved. So can you just spend 30 seconds, 90 seconds on what that is and how you're doing that and how that could potentially impact some of our community members in Detroit?
Absolutely. So I am an infectious disease specialist. I practice out of the University of Pittsburgh Medical Center, but I live in Southeastern Michigan. And I can do that because I am a telemedicine infectious disease specialist. What that is telemedicine is essentially a way for medical providers to communicate with individuals. And that can be via a virtual platform like we're doing today on Zoom, Doximity, or even telephonic consults. And so in many parts of the country, there's a huge shortage of infectious disease doctors. They're really in areas of major cities like New York City, Detroit, Washington, D.C., but in suburban areas or in rural areas, you don't find a lot of infectious disease specialists. It's always been important, but now in the age of COVID, it's become even more significantly important. And what we're doing through the University of Pittsburgh Medical Center is we're able to provide care, infectious disease care in these hospitals. We're set up on these TV platforms. We're going in and seeing patients. We've got nurses there. We use stethoscopes that are Bluetooth that we can listen to people's heart and lungs. What that does is we're helping the primary team treat and manage infections. We're treating the patients for infectious diseases, and we're allowing the patient to stay in that hospital. So they don't necessarily have to be transferred to a tertiary care center, for example, away from their loved ones, away from their home. They can get their treatment in-house in that hospital. And we are exponentially growing actually in this field.
Dr. Cunningham, I would be remiss if I did not ask my daughter's question that I feel like she asks me every week. When will there be a vaccine? How close are we to getting a vaccine for the younger kids? And also if you could speak to how the vaccine has been working and received by the kids that have already gotten it.
So the children who have received it, it seems to be tolerated very well. Again, you may have some side effects afterwards, but they're very brief. It beats the heck out of getting COVID. Henry Ford actually had a webinar for our employees, and I had my kids join me, Tisha Johnson Hooper, the chair of pediatrics, her daughter joined as well. And we wanted to let the teenagers talk about it and how well it's been doing. So I think that's great. There are ongoing studies right now for both Pfizer and Moderna looking at the vaccine's safety and efficacy in people under 12 years of age. If I was in Vegas, I would bet towards the end of summer, early fall, we'll have approval of some sort for these younger people who would certainly benefit from it.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.